Learn to answer next-gen NCLEX cases from expert test masters only here at GRA.
Ayan. So now we are at the newborn assessment. So client is in the recovery phase, vital signs monitored every 15 minutes and remain within normal parameters. The client shows no indications of hemorrhagic shock. Fundus is contracted at the midline. Perineal pad evaluated Q15. Pad is 25% saturated within the first 15 minutes. Turn the clients to side every 15 minutes and check for any bleeding underneath. No aberrations warrant reporting at this time. So there is nothing to report. Okay, now we start to assess the newborn. The newborn is male. The height is 45 centimeters. The weight is 7 kilograms. The skin is pink in tone with cyanosis of the hands and feet, with bluish discoloration in the sacral region. White pinhead-sized dots found on the patient's chin and trunk. Toxicum neonatorum is also noted on the baby's cheek. Positive caput succedaneum noted. Active sucking reflex demonstrating effective latching during breastfeeding attempts. Grunting and nasal flaring noted during breastfeeding. Irregular respirations noted at 60 breaths per minute, with periods of apnea lasting for 15 seconds. Heart rate is 200 beats per minute. Baby was crying during assessment. Auscultation of the heart reveals machine-like murmur. Full range of motion in all extremities. So these are the different newborn findings that we have read earlier. Tell me if it is normal or abnormal. Height 45 centimeter, weight 7 kilograms. Is this normal or abnormal? This one is abnormal, no? What can you say about this baby? Okay, what can you say about this baby? Yes, no? This baby is macrosomic. It's a big baby. Okay, if this baby attempted to join the NBA, he would be accepted because he's quite big. Okay, next, pink skin tone with cyanosis of the hands and feet. Normal or abnormal? This one is normal. This is normal because what do we call this? No? There is pink body, but the hands and feet are blue. Now, what do you call that? Very good. It's what you call as your acrocyanosis, and that is normal. Bluish discoloration in the sacral region. Normal or abnormal? That is also normal. Okay. Again, what do we call this one? If there is a bluish discoloration, yes, that's your Mongolian spot. Pin-sized dots found on the baby's chin and on the trunk. Excuse me. That is normal again. What do we call this? Very good. That's your milia. Okay. Toxicum neonatorum noted on the baby's cheek. Normal or abnormal? That is still normal, even though it sounds abnormal. No, toxicum neonatorum. Okay, but that is normal. That is a rash that develops on the cheek. That's a normal finding. Positive caput succedaneum. Normal or abnormal? Normal pa rin. Okay, what is a caput succedaneum? Now, what can you tell me about the baby's head? Is it one side or affects the entire side of the entire portion of the head of the baby? Is it unilateral or bilateral? Ang caput succedaneum. It's bilateral, no? It occurs on the entire part of the baby's head. No? In fact, the baby's head would look like an egg head, egg shape. Yes, cone, tama rin, cone head. Okay? It is bilateral. Remember, caput succedaneum is bilateral because it can cross the suture line, no? And we have a suture line in between, so it crosses, no? What is that head, not an abnormality, no, but a head change during pregnancy, during labor that is unilateral? What do we call it? No, it looks like a contusion. Now, what do we call that? Sa baby. No, they look like they have a contusion in their head, something like that. Now, if caput is like this, no, because it affects both part of the head, no, what is this one? It's still a normal variation of the newborn. It's still a normal variation. No, ito caput, succedaneum, yung isa. It's your cephal hematoma. Okay, cephal hematoma. So take note, caput succedaneum affects bilateral portions of your head, meaning it crosses the suture line, whereas cephal hematoma affects only one part of the head, unilateral. So it looks like a bump, no, a contusion in the head. They are both normal. No, they're both normal. Okay? To remember it, CS, caput succedaneum, crosses suture line. Crosses suture line. That's why it looks like a cone head. Whereas cephal hematoma does not cross the suture line, so one part. Okay? Grunting and nasal flaring noted during breastfeeding. Is that normal or abnormal? That is abnormal. No? Once your baby is grunting or nasal flaring, it means that he is having a hard time during breastfeeding. More or less, no, this manifestation is related to a cardiovascular problem. Okay? Irregular respirations noted with periods of apnea lasting for 15 seconds. Normal or abnormal? Again, that is normal. No? For newborns, their respirations are irregular, no? Their apnea should last for 15 seconds and not longer. If it lasts longer than 15, that it becomes abnormal. Okay? Heart rate is at 200 beats per minute, but the baby was crying. That's still normal. Okay? Take note that the baby's heart rate can go as high as 200 when they are agitated and as low as 90 when they are asleep. Auscultation of the heart reveals a machine-like murmur. That is abnormal. Okay, because machine-like murmur is a classical sign, it is a cardinal sign of what heart condition? Very good. It's your patent ductus arteriosus, PDA. So that's probably why the baby is grunting or nasal flaring during breastfeeding. Meron siyang cardiovascular problem. Okay? Okay, so let us now continue with your current NCLEX questions. A pregnant client at 38 weeks gestation is in the active phase of labor, presents to the labor and delivery unit. The nurse midwife performs an abdominal ultrasound and notes that the amniotic fluid index is around 3 centimeters. The nurse determines the appropriate intervention for this client is: letter A, prepare emergency cart for possible resuscitation. B, anticipate dystocia due to macrosomia. C, watch out for postpartum hemorrhage. Or D, expect a possibility of uterine atomy. Anong answer dito? Anong answer natin dyan? Letter A, very good. No? Letter A. Why letter A? No? If your amniotic fluid index is around 3 centimeters, what do you have? Do you have oligohydramnios or polyhydramnios? Oligo or polyhydramnios? Do you have more or less amniotic fluid? You have oligohydramnios, no? So, if a baby has oligohydramnios, you have to anticipate resuscitation when you deliver this baby, okay? Letter B is incorrect because macrosomia are for babies with polyhydramnios. Now, the reason why they have polyhydramnios because macrosomic babies exhibit symptoms similar to diabetic mellitus, meaning they keep urinating. No, they have polyuria. And remember, the fetus urine is the one that creates the amniotic fluid. Okay? Next, watch out for postpartum hemorrhage. That is again for polyhydramnios. The reason why mothers with polyhydramnios get postpartum hemorrhage, it's because their uterus is stretched too far from its normalcy. No? And because it is stretched too much, no, it will cause uterine atony. So letter C and letter D are the same. No? They're the same. Polyhydramnios. Okay? Once you have uterine atony, because the uterus is stretched thinly, you will get postpartum hemorrhage. Okay? So the normal fluid index, okay, amniotic fluid index would be around 7 centimeters to 25 centimeters. Okay, so definitely 3 is too low. No, too low. Okay, next. An OB nurse is preparing a lecture on common fetal testing done to a pregnant client. The OB nurse will be questioned if the nurse includes this statement in the lecture. Okay, the OB nurse would be questioned. Is this a positive or a negative statement? If you were questioned during a lecture, is that a positive or a negative statement? Negative statement, correct. If it is a negative statement, therefore, what statement are we looking for? False or true statements? False statements. Okay? So you are looking for false statements that the nurse said. Okay, sige. A reactive non-stress test means that the fetal heart rate increases as the uterus contracts. True or false? Reactive non-stress test, fetal heart rate increase as the uterus contracts. Okay, this is a false statement. So, kunin mo yan. No? It is a false statement because, as we know, a non-stress test compares fetal heart rate with what? In a non-stress test, you compare the fetal heart rate with the very good fetal movement. Okay? You compare the fetal heart rate with the fetal movement. If the fetus moves, the heart rate should increase or decrease? Increase. Okay, so letter A is false. Now, when you compare the fetal heart rate to uterine contraction, what tests are you doing? What tests are you performing if you compare the fetal heart rate to the uterine contraction? You are performing what type of test? No, you already know this. You remember this. It's your contraction stress test, correct? Also known as your oxytocin challenge test. Okay, next. We encourage the client to void prior biophysical profile. True or false? We encourage the client to void prior or before a biophysical profile. True or false? This one is false. No? When you're going to perform a biophysical profile, this is done using an ultrasound. What type of ultrasound? Intra-abdominal or intravaginal? abdominal or intravaginal. What type of ultrasound are you going to perform? Abdominal. And when you're going to perform an abdominal ultrasound for a pregnant client, what do we want when it comes to the bladder? Full or empty? Full bladder. So this is why it is false, because you want a full bladder. No, do you still remember? No, I hope it's coming back. Okay. Contraction stress test would require an informed consent before being done. True or false? Do you require an informed consent for a contraction stress test? This one is true. Why is it true? No? Is contraction stress test invasive? Or is there an invasive maneuver performed? Very good, no? It is invasive because you are given an oxytocin medication parenterally. Remember, parenteral medications require informed consent because you are being pricked with a medication. So this one is true. So let's remove this one. Okay. The best time to monitor for fetal movement would be after meals. True or false? This one is true. No? When you're going to perform fetal kicks, no, when you're going to assess for fetal kicks, the best time to perform that one is after feeding. Now, after the mother has eaten. Once the mother has eaten, the baby starts to move. So this one is true. Amniocentesis is a routine procedure included in fetal well-being tests. No? When you say routine, all mothers go through it. True or false? This one is false. Now, because amniocentesis is usually done for mothers that are high risk, or if the doctor has seen that not just the pregnancy is high risk, but there is abnormalities in the baby. Okay, so the false statements here are A, B, and E.
Follow us for more of this and learn with confidence only at GRA.